We've talked about planets, animals, prisons. Today we're staying on Earth. But the enemy is invisible, because the deadliest killers in human history aren't sharks. They aren't lions. They aren't even wars. They're microscopic, and they've killed more humans than everything else combined. These are the diseases that could kill you, and exactly what they do to your body. Let's start with the one that almost ended civilization. The Black Death arrived in Europe in 1347. By 1351, it was gone. In those 4 years, it killed somewhere between 75 and 200 million people. 1 in 3 Europeans. Dead. Here's how it works. A flea bites an infected rat, then it bites you. The bacteria, Yersinia pestis, enters your bloodstream. Within days, your lymph nodes begin to swell. They can reach the size of an apple. They're called buboes. That's where the name bubonic plague comes from. Then your tissue starts to die. The dead tissue turns black. That's why it was called the Black Death. Your skin darkens and rots while you're still alive. Then comes the fever, the vomiting, the coughing up of blood. Without treatment, between 30 and 75% of people who caught it died. And here's what I find genuinely unsettling about plague. It never went away. There are still around 2,000 cases per year worldwide. The bacteria is still out there. We just have antibiotics now. If plague is terrifying because of scale, Ebola is terrifying because of what it does to a single body. Ebola has a death rate of up to 90%. 9 out of 10 people who catch it die from it. And the way it kills is unlike almost anything else in nature. Ebola targets your immune system first. It hijacks it, turns it against you. Then it goes after every organ simultaneously. By day 4 or 5, you're vomiting and experiencing severe diarrhea. By day 6 or 7, internal bleeding begins. The organs don't just fail, they dissolve. The tissue literally liquefies. By day 8 or 9, you're bleeding from your eyes, your ears, your nose, every opening in the body. You've lost control of every system. By day 10, in most cases, it's over. 10 days, start to finish. One of the fastest, most violent deaths in nature. And there is still no widely available cure. Rabies might be the most terrifying disease on this list. Not because of how many people it kills, but because of what it does to your mind before it kills you. An animal bites you. A dog, a bat, a fox, the rabies virus enters through the wound and begins travelling along your nerve cells towards your brain. It moves at about 12 to 24 millimeters per day. Slowly, silently. For 1 to 3 months, you feel completely fine. No symptoms, no warning. Then it reaches your brain. Within days of that moment, you begin experiencing anxiety, confusion, and hallucinations. Then something called hydrophobia develops, a fear of water. Your brain becomes so inflamed that you can't swallow. You are dying of thirst while surrounded by water you cannot drink. Then seizures, paralysis, coma, death. Here is the part that genuinely gets me. If you receive the vaccine before symptoms appear, you survive. 100%. But once symptoms begin, once the virus reaches the brain, the survival rate is essentially 0. There are fewer than 20 documented cases of survival in all of recorded history. The window between alive and dead is getting the shot in time. That's it. That's the only variable. Cholera kills faster than almost any other disease on this list. A completely healthy adult can be dead within 18 hours of their first symptom. Here's what happens. You drink contaminated water. The bacteria, Vibrio cholerae, enters your digestive system and begins producing a toxin that causes your body to expel fluid at an extraordinary rate. Diarrhea begins, then vomiting, then both simultaneously. Your body loses fluid faster than you can replace it. Within hours, you're severely dehydrated. Your skin turns a distinctive pale blue, which is why cholera was historically called the Blue Death. Your eyes sink into your skull. Your muscles cramp violently. Then organ failure. Then death. The treatment is almost insultingly simple. Oral rehydration salts, water, salt and sugar. It costs pennies. It works almost instantly. And yet cholera still kills around 140,000 people every year. Because 140,000 people per year don't have access to clean water or pennies worth of salts. That's not a medical failure. That's something else. Smallpox is the only human disease that has ever been officially eradicated. That alone tells you something. In the 20th century alone, not all of history, just the 20th century, smallpox killed an estimated 300 million people. More than both world wars combined. More than 3 times more. Smallpox spreads through the air. You breathe it in. Within 2 weeks, pustules begin appearing across your entire body. Your face, your hands, the inside of your mouth, even inside your eyelids. Death rate, around 30% in adults. In children, up to 80%. If you survived, you were often left blind, permanently scarred, deformed. In 1796, Edward Jenner developed the first vaccine in history specifically to fight smallpox. After nearly 2 centuries of vaccination campaigns, the World Health Organization declared it eradicated in 1980. Gone. The only human disease we have ever completely eliminated. But here's what I find unsettling. 2 samples still exist. One in Atlanta, one in Novosibirsk, Russia. Locked in freezers, just in case. The most dangerous freezer in the world. Typhus is spread by body lice. And war creates the perfect conditions for body lice. Crowded trenches, no showers, the same clothes worn for weeks. Which is why typhus has killed more soldiers throughout history than bullets ever did. When Napoleon invaded Russia in 1812, he entered with 600,000 soldiers. He returned with around 100,000. Most of the losses weren't from Russian forces. They were from typhus. The disease causes high fever, severe headache, and a full body rash. Then delirium. Then organ failure. Death rate ranges from 10 to 60% depending on conditions. Typhus didn't just change military outcomes. It killed Anne Frank in Bergen-Belsen concentration camp in 1945. She was 15 years old. She had survived everything else they put her through. A louse ended it, a tiny insect. That changed the course of history, multiple times. And now the one that surprises everyone, because it can start with a paper cut. Necrotizing fasciitis, flesh-eating bacteria, is a bacterial infection that spreads through soft tissue at a rate of centimeters per hour. It destroys muscle, fat, and skin as it moves, and it moves fast. The terrifying thing is the entry point. It doesn't need a serious wound, a small cut, a scrape, an insect bite. The bacteria enters and immediately begins releasing toxins that destroy the surrounding tissue. By the time you feel serious pain, which is often described as pain far beyond what the visible wound should cause, the bacteria has already spread significantly. Surgeons describe racing against it, cutting ahead of the infection, removing healthy tissue, trying to stay ahead. Often the only option is amputation. Remove the limb to save the life. Without treatment, the death rate is over 70%. And even with emergency surgery, around 25% of patients die. It entered through a paper cut. It ate the rest. So which would kill you fastest? Cholera in 18 hours. Ebola in 10 days. The flesh-eating bacteria in 24 hours if you're unlucky. But speed isn't what makes a disease the worst. The worst is the one you don't see coming. The one that looks like a flea bite, a sip of water, a scratch from a dog. These things killed more humans than every war, every famine, every natural disaster in history, combined. And most of them are still out there, smaller than anything you can see, older than anything you can imagine, and still very much alive. Next video, something completely different.